Yang is one of the people use the implant. Specifically, this person is Huong Giang. As you can see, it's very soft and natural. I used a teardrop implant for Yang to give her just a beautiful and natural shape. What about a subglandular placement? It's when the implant is placed under the breast tissue and you can really see the shape of the implant like an upside down bowl. Hello everyone. Today Huong Giang is here to share some tips on how to achieve a beautiful breast and introduce the latest technology in breast augmentation on directly advised and performed by Dr. Chiem Quoc Thai. I am a living example, staying up to date with beautiful methods and always sharing with everyone the best way to enhance their breast. Now, let's dive into this video. Dr. Chiem Quoc Thai, may I ask why it is so important for us to constantly upgrade and improve breast augmentation methods? Hello everyone. As you all know, breast augmentation is a familiar procedure while making breasts bigger, easy and simple for the skilled surgeon. Achieving a natural, alluring look where the implants appear just like real breasts is a different story. Even as a cosmetic surgeon myself, I sometimes can't tell whether the pair of breasts are natural or augmented. Some implants are done so beautifully that even I, who perform the procedure, feel amazed. So, why is it essential to constantly refine and improve techniques to make implants look like real breasts? That's the story we're here to share with you today. A well-known doctor for creating incredibly beautiful breasts. According to you, to enhance the breast, what is the most important factor? Is it the implant, the material, the base body type, surgeon skill? How would you evaluate the importance of each aspect? In general, whether it's breast augmentation or anything else, it's like making a delicious dish. You need a skilled chef, quality ingredients, and everything must be top-notch to create a great result. The same applies to breast implants. Besides the surgeon's expertise, which is a must, the quality of the implants also need to be guaranteed and of the best type. Even the most skilled surgeon can't achieve success with unsafe implants. And if it's well, you won't know whether it's what the surgeon or the implant that caused the problem. A reputable surgeon would never use low-quality implants because that would damage their reputation. Why do people often say that the breast implant need to be redone every 8 or 10 years? It is this true now? And why older breast implants no longer used and recommended to be replaced with new ones? As you may know, before 2006, the United States did not approve the use of gel implants. Saline implants were the only option, but however, after 2006, US allowed the use of gel implants, led to a shift away from saline implants. Although saline implants were safe, were quite firm, whereas gel implants are smoother, lighter, and softer. Over time, newer and better implant options have been developed, so manufacturers and experts typically recommend replacing implants every 10 to 15 years. That being said, it's worth noting that high-quality implants can still be safe for a lifetime if they remain in good condition and don't cause any issue for the body. According to you, which breast implants do you currently consider the most optimal with the best advantage and most favor for use at Viet Cosmetic Hospital? Currently, I have many brands from the US such as Mentor and Motiva, and these implants are absolutely safe. I am using these safe implants now, and depend on each individual's body and needs, I will choose the most suitable implant for them. Especially Motiva implants which have a flexible shape similar to a teardrop. Zhang knows this very well. I know. So I also honestly share with everyone that I am one of the people using this backlight. Especially it's me. And everyone can see that it's soft and very natural. I use teardrop implants for Yang to give Huong Giang a very natural looking shape. So what do teardrop implants do? They help you have a very realistic breast shape and it looks very natural. Also, when you use these teardrop implants combined with submuscular placement, it will create a very natural breast shape for women. placement without the inverted bow experience. That's it, Asiano. Can you tell clearly about the place submuscular implants and subglandular implants? So when you place it under the muscle, you rely on the muscle layer to cover the implant. Then it has a natural slope. The advantage is that it will hide the inverted bow experience. So, what if your blade is subglandular? It's above the muscle. The implant will be clearly visible on your skin, and you can see the whole implant. So, people often say that a breast implant has an inverted bow look. That's why when we wear push-up bras, the curves become completely visible, right? So, what are the advantages and disadvantages of those two placement options? Yes, placing it under the muscle is fantastic, while placing it over the muscle has many disadvantages. That's why I rarely place it over the muscle anymore. I opt for placing it under the muscle. So, what happens with places over the muscle? It's also called the over the muscle placement or the subglandular method. What does subglandular? It means that when you place it this way, the implant becomes clearly visible on your chest. You can see the letter G standing out, right? It's like an upside down bow, and you see the implant showing prominently. It doesn't look natural and resemble an upside down bow. Even if placed under the gland, implant becomes visible. You can feel the entire implant here, and it feels uneven and lumpy. That's why the subglandular placement method should be abandoned. Instead, implants should be placed under the muscle because it completely eliminates those disadvantages. For that reason, I plan to completely phase out the subglandular method and exclusively use the submuscular placement in the future to solve all these issues. Furthermore, submuscular placement offers a significant advantage, reducing the risk of capsular contracture. If placed under the gland, capsular contracture is much more likely to occur. Typically, the rate is around 10% in the first year, but it's increased significantly over time, causing the implant to harden. However, with submuscular placement, the rate of capsular contracture is only about 1 to 2% softer because the implant is placed under the muscle, which acts as a protective layer. This gives it a soft and natural feel. The second benefit is that it reduces the risk of capsular contracture. You can touch the breast without feeling the implant, as the muscle layer provides protection. It feels as natural as a real breast. The third benefit is that when placed under the muscle, the implant is smoothly beneath the muscle layer and away from the breast tissue. This means that if you have any breasts or abnormalities, they can easily detect it during an ultrasound. In contrast with the old method of placing the implant directly under the breast tissue, the implant might press against the mucus, making it harder to detect lumps or abnormalities during an ultrasound. Everyone is complimenting me on how beautiful the dress I'm wearing today is. Let's give it a try now, shall we? Could you briefly introduce which breast types or body shapes are best suited for each implant option available here? Here, it depends on each person's body type. For those who prefer a subtle enhancement, wanting their breast implants to look so natural that no one can tell, the teardrop shaped implant would be the ideal choice. For example, the teardrop shaped implant is sloped downward, resembling the shape of the teardrop. Look at this. Oh, I see it has something. This is called the chip. People refer to it as the chip implant. So what a chip for? Often, women forget to keep a warranty card for the implants. This brand came up with the idea of embedding a chip in the implant, which can be scanned by a special machine. If you forgot or don't know what kind of implant you have, these chips allow the doctor to identify the implant details. For example, many people, especially those who had their implants done in the places like Thailand, often can remember the size or the type of implant they had. Without a warranty card, I can simply take out the check its size and calculate how many cc's it is, so I know exactly what to work with. People often say, yeah, I want a bigger size, so I need to take it out to figure out the exact size. But with these chips, even if you come back 10 years later and say, Mr. Thai, I want a bigger size, and you have forgotten what you had, I can just use the scanner. It instantly displays the details of your implant size, so no need to worry about forgetting the specifics. Wow, it's like a designer bag with a code, right? That's why some people call it a designer breast implant. Exactly, the chips is really just a convenient feature. Do not worry about it because the real focus should be on the gel and the surface of the implants because those are what determine the quality. Also, what is this, doctor? Ah, this implant for birth. Oh, really? For the birth implant, we would schedule a separate session with the audience, right? This is for the birth implants, everyone. There are many types of implants, including Motiva. They come in various shapes and sizes. The Thai is very quite famous, right? Especially famous for his work on the birth. So we'll probably schedule another video more about that. Since we are talking about the breast day, so everyone, how beautiful does Huong Giang looks today? Doesn't she look absolutely stunning? To be honest, I'm one of those who has been transgender many years ago, and honestly, I always been worried because I've heard people say that after many years, nearly like 10 years, breast implant can develop capsular contracture, lead to the potential of cancer. It makes me quite anxious. But one of the blessings for me is that I'm an ambassador for Viet Cosmetic Hospital, so everyone can see me. Everything is improving and I'm looking better and better. So let me ask, why does it lead to issues like capsular contracture, hardening, visible implant edges, or even cancers? What are the root causes of these problems? Breast implants nowadays do not cause cancer except for cases involving texture implants. These are currently under investigation due to suspicion and are being recalled. Now we primarily use smooth implants or super texture implants. Structure implants are being phased out in the US and by various companies worldwide due to the rare but potential risk of cancer. However, this is still under suspicion and extremely rare. That's why structure implants are no longer in use. If you choose smooth or super structure implants, there is no risk of cancer. Keep that in mind. As for your question about why implants cause hardening or capsular contracture, I already explained. If implants are placed under the breast tissue, the risk of capsular contracture is 5 to 10% after just 1 year. Over time, this risk increases and the implant can become as hard as a rock, contracting and distorting the breast. Fixing such cases is extremely challenging, which is why the underbreastplacement method is no longer recommended. Right, I hope everyone will send a lot of questions about breast surgery, how to enhance your beauty and address any concern you may have. We answer all your questions in the next parts of this live stream. Now, I want to say something. Many people want to improve their experience, but breast surgery is one of the procedures that people fear the most. This is because it involves general anesthesia, and they worry about the pain and need for a long recovery period afterward. So could you explain the pre-operative and post-operative aspect of breast surgery, especially how to prepare beforehand and what to expect during recovery to address the common fears? As you can see, breast surgery is so simple. Many people are afraid of it, but when it's done, they realize how straightforward it is, right? You only need to plan for 2-day recovery period. Just 2 days, that's all. Exactly just 2 days, you can comfortably go home. Please do not worry, it might sound complicated, but most endoscopic breast augmentation procedures are much easier than you think. You come in for procedure, and after 2 days, you can go home. Once at home, you can do light activities such as sitting at a desk or writing, but remember, no heavy lifting or use your strength. Is this really pain when it's done, doctor? There is some discomfort, of course, like a tight feeling when the implant is inserted, which is normal, but you need to take the depression is the painkillers, and the pain will gradually decrease. Also, you already done the procedure, Yang. Can you share your perspective with everyone? How work is for you, Yang? Based on my experience, I didn't find it overly painful, even though I had to create an entirely new breast pocket. Honestly, it wasn't as bad as I thought. In the beginning, sitting up was a bit challenging, and the hardest part was wearing the compression rod for a whole month, right? Another thing is that even though I could move around normally, sleeping required a bit of extra care initially. However, after 3 to 4 days, I could do some light activity, avoiding anything too strenuous. In the next 15 days, I remember I was already jumping around and moving freely. So there's really not much to worry about this. The result is completely normal, which was the most rewarding part. People are definitely interested in the cost, right? So how do you evaluate the price of Motiva implants compared to the market? And generally, how much does it cost for someone to get a beautiful breast augmentation? The Motiva implants come in 3 types: Type 1, Type 2, and Type 3. For the Teardrop Safe Type 1, the price at our hospital is around 90 million VND. Type 2 costs about 65 million VND, and the Type 3 is priced at 55 million VND. However, Motiva often offers promotion for the customers. Currently, our hospital, in collaboration with the Motiva brands, is offering a 20% discount for Lanh. Nguyen is worth for the price because the most important thing is extremely beautiful and the complication rate is extremely low. The rate of capsular contracture is only about 1%. The living proof is right here. This is the evidence, a living example, very beautiful and natural. Everyone has been commenting that my breast looks stunning. This is the proof of using Motiva Teardrop implants, everyone. It looks so completely beautiful. Doctor, everyone keeps saying it looks stunning and fantastic. They are interacting and talking about saying money. Some people are saying their breasts are too flat and they want to make it bigger. So, in your opinion, for someone like me, based on weight and body type, how many cc should they choose for their implants? The number of cc isn't the most important thing. What really matters is the personal reference. For example, there was a lion who was only 1.5 meters tall, but say, I don't have the height, so I'll go for 400cc to make sure people focus on me. You see, choosing a size is all about the personal taste, and it's hard to generalize. Usually when someone comes to me, I'll ask, what did you prefer? Do you want a sexy look, or do you prefer something more natural that no one will even notice? Only then I can recommend the right size. People have been asking if there are any food restrictions after breast surgery. As I mentioned earlier, on the first day after surgery, just rest and take it easy. The next day you can work at the desk but avoid heavy lifting in the initial days. How about food? No need to worry. No worries? As for foods, there's no need to avoid much. The only thing to stay clear of is seafood. Otherwise, eat whatever helps you stay healthy. No need to avoid any other foods unless you are allergic to seafood. Also, when it comes to underarm incision, there's no need to avoid anything because the scar will naturally heal and it won't affect the healing process. Some people say they need to choose between incision to areolar and one through the armpits. How are they different? If the incision is made through the areolar, it involves cutting to the mammary gland. For the under the breast method, as mentioned earlier, is straightforward. Just go through the areolar, access the gland, place the implant inside. On the other hand, the armpit incision is best suited for the endoscopic techniques, particularly for placing implants under the muscle. With this method, you simply lift the muscle like with the armpit approach, release it and place the implant inside without causing bleeding. Endoscopic techniques are the best option. However, for those who specifically request incision to the breast, this is usually for placing the implant under the gland above the muscle. People often ask if breasts are a concern when considering breast augmentation. Breasts are typically benign, so the procedure can be done as usual. If you order, it's a good idea to monitor your condition with regular ultrasound every 6 months. Since breasts are benign, they don't have any negative impact on the surgery. A 15-year-old teenager get breast augmentation? No, it's not recommended. You should wait until you are at least 18 years old. Can I get a breast augmentation if I have a lump in my breast? It depends on the type of lump. If it's benign and small, the procedure can typically be done without issue. When placing the implant under the muscle, the lump, benign or otherwise, won't interfere with the implants, as the muscle layer provides a barrier. The rest tissue lies above the muscle and the implant sits below it, so there's nothing to worry about it in this case. If the lump is benign, you can proceed with the augmentation as usual. If the lump is large, you can either schedule a separate procedure to remove it or request that I remove it during the augmentation surgery itself. If the lump is malignant, it's necessary to remove it first before considering breast augmentation. Next question for the people who are curious about, and I am too, regarding scar. They are afraid that it will leave a scar, but if you look, the scar is quite small. I don't understand why it looks so big, because the actual scar is so tiny. People don't understand how we apply it in such a way. skills of a doctor. That's how it is. For example, as the US doctor, their hands are so big, so if they make an incision in the armpit, which would be very difficult for them, they can make a cut of 10 centimeters when making an incision in the pocket. For in the US, doctor often recommend making an incision in the breast area. In Asia, however, especially for Vietnamese doctor with skillful hands, making an incision in the armpit area is really rare. As small as you, I would make a 3 centimeter incision in your breast and it's very beautiful. People commented that my breasts are not too big or too small. It's very beautiful. You see, even though my fans are very young, they give very level comments. I'm really proud of them. Even though they're still young, they always give in the right opinions. And just now, someone said something really cute. They asked if taking weight loss pills after breast surgery should cause the breast to shrink. Alright. The breast implant doesn't shrink. What shrinks is the tissue and the fat. When you lose weight, the fat in your breast will shrink. So you might feel like they shrunk, but that's just the fat in your breast shrinking, not the implant itself. The implant won't shrink. Following question, this is related to their concerns, is about breastfeeding. So does the breastfeeding have any effect on it? If you place the implant under the muscle, it won't affect breastfeeding. Placing the implant under the muscle is absolutely good because it doesn't affect any milk ducts, so you can breastfeed normally. Nguyen asks, should we get breast surgery before or after having children? Surgery is a related cosmetic procedure and having children is another topic. However, if you decide to get breast implant before having children, you should wait at least 6 months, that's it. So, it should be at least 6 months before having children, because within 6 months, the implants will have settled into their proper position and will shift to unintended areas. If you get pregnant during this time, the breast will swell and might push the implants out of alignment. That's why it's better to wait at least 6 months before having children. Please be advised it's recommended to wait at least 6 months to allow the implant to stabilize. Does this leave any scar after surgeries? Yes, of course, there will be. But it's very discreet and beautiful, you won't even notice. We got a lot of questions about financing option for cosmetic procedures. Someone even joked about getting a loan for breast augmentation. Wow, people are asking a lot of questions here. Of course, I think it's because you look amazing and they're curious about this. Huong Giang asked if the implants can be long-lasting after surgery or if they need to be replaced. I recommend replacing them every 15 years. However, if you are not affordable, they can potentially last permanently. Nguyen asked if there is any type that is good at preventing capsular contracture. According to me, Motiva is one of the leading implant brands in the preventing capsular contracture. The rate is very low, only 1%. Do you offer a cosmetic procedure like eyelid surgery or rhinoplasty? Of course we have. We offer a lot of procedures, everyone. Oh gosh, so many questions. Apart from placing implant on someone who has flat breasts, in cases where a person already has breasts, but they are sagging or deformed, they just too lag but only sagging, what method would you use in this case? It would be a method called breast lip surgery. If the person only has sagging breasts without them being too large, we would just remove excess skin. This lifts the breast. If the breasts are too large or sagging, we would reduce the glandular tissue and remove the excess tissue they don't want, while keeping enough to maintain a natural and lifted shape. For someone who has previously had breast surgery, for example, if they had implant placed above the muscle but now they are experiencing issues like implant flipping or the type of implant used by them has problems, what challenges might arise when they do need to redo the surgery compared to getting a new one? Also, could you explain the term like pocket creation and other related slippages? Lucky is that if the implants were placed above the muscle or below the gland and you experience implant flipping, it's actually a bit lucky for the surgeon because your submuscular pocket hasn't been formed yet and your muscle capsule has been locked in place. Since you haven't created a pocket under the muscle, the surgeon will remove the implant from under the gland and then create a completely new pocket under the muscle. When placing the implant under the muscle, a free rest capsule has been already formed. So during this process, the surgeon will remove the free rest capsule and make the area softer. In cases where the capsule has calcified, hardened, or become uneven, the surgeon will use the tissue to fix it. These are more complex cases, but for the surgeon, this situation quite common and they will handle them normally. So just come to see Dr. Thái for help with the issues. People ask how we could achieve beautiful breasts like Huong Giang. Come to me, you will have nice breasts like Yang. Is there a way to make the breast softer after surgery? If you choose the best implant and work with a highly professional surgeon with excellent skills, your success rate is 99%. Only 1% of the time you might experience capsular contracture, but the remaining 99% will result in soft breast. But what I mean is, I'm asking about methods like massage, diet, or something like that. When you go to the doctor, they will guide you. Those methods you mentioned are simple and just supportive. The important things still are the breast implant and the doctor's skills. Alright, this is a common question. After breast surgery, how long does it take before your husband can touch them? In the first week, I recommend that the husband should start touching gently, doing light massages. Don't think of it as intense massaging. It's just about your husband touching your breast to have blood circulation. Not every husband can touch gently. No, it's more about resting firmly, massaging to move the breast implant around. A boyfriend can, right? After 2 weeks, the husband can be intimate with his wife. Without them, can we do it by ourselves? Of course, but gently, like when you're taking a shower. Many people want to know how to look beautiful and how long it takes for the breast to look naturally beautiful like Miss Young's. You should answer this. I think it takes about 2 weeks or a month. 2 weeks would be amazing, but after 2 weeks or a month, the swelling might not be completely gone, right? It will shrink a bit, but to look the best, it really takes about 3 months. But if you want the breasts to look stunning from having no chest at all to something amazing, 2 weeks should be good enough. Don't you think so? It's already fantastic. You open up and then say, wow! But even for me, 2 years ago when I did a live stream with 10 breast surgeries on at once, and then gave breast envelopes, I looked at those breasts and thought, wow, they look amazing. So when you get breast surgery, you look incredibly beautiful. Does the bride change every time you get the new breast implants? Yes, if you get it done with me, it's cheaper. But if you go to another doctor and can come to me for adjustment, it will cost double at the times. Oh, really? If you had your implants done with me 10 years ago, I usually offer a discount when you come back for replacement. If you had the old type of implants and now you don't like them or want a larger size, I always offer better deals or lower price for the new implants. People ask if someone who is transgender and has no breasts can still get the procedure done. It's totally fine, easy. Like for me, it's just a user process. This is related to a personal concern everyone. Next question. If it's in the 1% situation, how do we handle that? If you find yourself in that 1% situation, I will help you by removing the implant and cutting out the capsule. Then I will switch the surface to a different type. Like if you're using a Motiva implant now, I will cut the capsule and replace it with the Mentor implant, which is one of the top brands from the US. People ask how long after the surgery they can take a shower? You can begin showering after 2 days. For the initial 2 days, it's crucial to keep the incision site dry. Avoid direct water contact. Your body will naturally protect the area. When you do the shower, simply wash normally, keeping the shower stream away from the incision. After showering, gently pat the area dry. Do not rub. After the first 2 days, you can shower as you normally would. You can shower as usual. Next, Misa asks if the breasts are too much after childbirth and you want to lift them. What is the most challenging part? The most challenging part now is lifting the breast. For that, just visit a skillful doctor in breast lifts to solve the problem. In general, if you have any question that can be answered during the live stream, you can come to the Viet Cosmetic Hospital directly to get consulting and guidance. They want to know, does the Dr. Thai perform the procedures directly? Let me take this opportunity to address a common question. Do I perform the procedures myself? As Young knows, I actually set a limit of only 15 breast surgeries per day. For example, even if I have a lot of clients, I only schedule a maximum of 15 cases. You see, many people ask if I perform the surgeries myself. To clarify, even though I handle up to 15 breast cases a day, I also take on additional cases like rhinoplasty or other procedures. Let me explain. Perform breast surgery takes about 45 minutes to achieve a perfect, beautiful result. Think of it like building a house. The main builder doesn't do everything, but they focus on the most important parts that require a highest level of skill and precision. I'm the lead surgeon. I personally handle critical steps such as creating and adjust the implant pocket to make it look beautiful. Meanwhile, my assisting doctor help with tasks like controlling bleeding or other steps that take time. Those assisting tasks, which might take about 25 minutes, are handled by others under my supervision. People often ask, does Dr. Thai really do the surgeries? Because they think it's impossible for me to manage so many cases. But let me assure you, I do. With me, Cosmetic Hospital is my brand. And when you come to my hospital, your surgery will bear my name and guarantee. Of course, I will be the one directly involved. Think of it this way. When you buy a Chanel bag, you trust the brand to deliver authentic quality, even if you don't know who exactly make it. You trust the channel as reputable luxury brand. Similar, when you come to with me, you can trust that I'll be the one ensuring you have the most beautiful and professional result. It's my name and my reputation at stake, and I take that very seriously. So just like you trust Chanel to deliver a genuine leather bag, you can trust me to deliver the highest quality result for your surgery. No need to worry at all. People are asking if anyone is paying attention to my breast, especially since I'm wearing a dress with a slight neckline today. Does she look elegant and beautiful today, everyone? Oh, my fans say they want to massage me. Alright, my breast is extremely soft. Yes, extremely soft. You don't need to massage too much. Nguyen asks, does breast augmentation affect your health? Actually, breast augmentation does not affect your health at all. As I mentioned, I only perform the procedure if your health is in good condition. It's purely a cosmetic surgery, so it doesn't impact your health, your ability to fresh treat or anything else. So what condition makes someone unable to get augmentation? Alright, if you have a chronic condition like diabetes or being tested for pulmonary tuberculosis, I generally advise against proceeding until those conditions are well managed. Certain conditions pose significant risk. For example, individuals with HIV should avoid cosmetic treatments, as the introduction of implants or other material can compromise the immune system and increase the risk of infection. Similarly, patients undergoing treatment for cancer should not undergo cosmetic procedures. These are some of the most important factors we assess to ensure your safety and optimal outcome. Yes, that makes sense. As a doctor specializing in cosmetic surgery, and also as a man who appreciates the aesthetic, what are your thoughts on what makes a breast truly beautiful from your perspective? In my opinion, yes, breasts are a fantastic example of ideal proportion. Notice how they have a natural gentle curve, not completely fat, but with a beautiful shape. What is a gentle curve? What I mean by the curve is a subtle downward slope, not completely fat, as we discussed. A beautiful breast has a natural flowing contour. Secondly, the cleavage should just be right, not too much, not too little. When wearing a top, a cleavage about the width of a finger is ideal. Finally, regardless of the breast size, it shouldn't be flat. This is where advanced techniques like submuscular placement come into play. The surgeon carefully positions the implant beneath the muscle, a procedure that requires a high level of skill and expertise. For people with a slender frame and a very flat chest, how do we achieve a natural, beautifully gentle curve in the breast area? I use Lim Yang. Easy limbs, everyone. I've already said earlier, if we place the implants under the muscle, we can address those issues. Can needle as we get fragmentation that is affect the loss of sensation? While placing implant through the areola can sometimes affect sensation. Alternative approach like submuscular placement or incisions in the armpits have resulted. Endoscopic breast augmentation in particular offer a minimal invasive option with excellent results in terms of maintaining sensations. One of my fans suggested that I try a deeper neckline, which I find amusing. This is really cute. They said if I wear a deeper line, it might look even better. And people ask how someone with a body like mine, what would make an ideal look with breast augmentation? I prefer a smaller size around 300cc. 300cc would be just right for you. Can you give me a visual comparison? What does 300cc look like next to 400cc? Could you hold them up so we can see if there's a noticeable difference? Sure, each size has on its distinction. Here's a 320cc. You notice that it's not a huge difference. Yang, you can try to look at it, Yang. You can see the cc in here. Oh yeah, yes, the difference isn't very pronounced. Exactly, a difference of just 20 cc isn't significant, but 100 cc difference would be definitely be noticeable. It feels really soft. After about 1 to 3 months, the practitioner becomes completely soft and look absolutely stunning. What age do you recommend for rectal augmentation? I would recommend it for those over 18. In fact, I have had patients as old as 60 or 65 who has successfully undergone breast augmentation without any problem. Why do some lineage say they perform the endoscopic surgery but they still make incision around the nipple? If the incision is made on the breast or areola, that's not considered true endoscopic surgery. Endoscopic involving using a camera from a distance. Think of it like holding a camera far away to get a view of the area. If the camera is too close, like at the nipple, you won't see much, or more like looking at something right in front of your face. Endoscopic procedure require a distant purpose step. An incision at the areola is a direct incision, not endoscopic. Another concern people often have is about nipple reduction. Many patients ask me about the nipple reduction and express worries about losing sensation. I reassure them that the sensation will not be lost. Consider your nipple like a tree trunk. The base where the nerves are located is like the roots. The outer part of the nipple is like the branches and leaves. When we reduce the size, we merely shaping the outer edges without affecting the base, which contains the nerve ending. They remain intact so you won't lose any sensation, and it's straightforward and aesthetically pleasing procedure. If we're not using breast implants, is fat grafting a viable alternative? Absolutely. If you have enough body fat, fat rating is a rich option. There are so many questions out there, and while we cover some common ones today, I know there's still more to discuss. For anyone interested in achieving beautiful breasts like mine, you can come to Viet Cosmetic Hospital and schedule a consultation with Dr. Chiem Quoc Thai. Many people are still asking the same if you perform the procedure directly. That's a frequent question I get. Patients often ask, Doctor, I heard that you don't personally perform surgeries. This confusion might stem from misinformation or competition or trying to mislead my patients. Some might say, don't go to Dr. Thái, he doesn't do the surgeries, come with me for a different option. There are also middlemen looking for commission, but in my practice, we don't collaborate with brokers. I provide promotion directly to patients, including a current 20% discount on Motiva implants, and there are no commission for referrals. Unfortunately, some individuals spread the phone information online in an attempt to tarnish my reputation. I truly believe that the breast is one of the most significant and attractive features of a woman's body. A beautiful natural breast boosts self-confidence and allows us to wear various styles and from legless dresses to deep cut tops or even more modest outfits. A well-shaped breast enhances allure, which is why I feel so confident during live TV appearances and events. I know I have a naturally beautiful breast. We have answered many questions about breast augmentation today, and I encourage everyone to do their own research on this topic. Many are still curious about the price, so feel free to leave your comment here. Yes, you can leave your comments on the Viet Cosmetic Hospital Facebook page where I pinned the link. I want to extend my gratitude to Dr. Thái for joining me today and sharing valuable insight about breast augmentation. I hope everyone can make informed decisions to transform into their most beautiful selves. We all deserve to feel confident and captivating, especially to those who love us the most. That's wrap up today's live stream. I look forward to seeing you guys again in the next video, where we'll discuss topics like facial lifting, body contour, waist and hip shaping, fat rafting, and much more. So stay tuned for this series. Thanks once again from me, Huong Giang, the ambassador for Viet Cosmetic Hospital, and Dr. Chiem Quoc Thai. See you next time.